All right, let's dive into something really relevant, especially with those Year 11 health and social care exams coming up.
You got it.
It's all about how the environment around us, where we live, work, and play, can actually impact our well-being.
And not just physically.
Right, we're talking the whole package.
Yeah.
Physical, emotional, even social well-being.
It's all connected, really.
Think of this deep dive as like a cheat sheet for those exams.
Exactly. We're going to unpack those often overlooked factors that can have a ripple effect on your health.
Okay, so our sources lay out three main areas,
Pollution, occupational hazards,
and even something called the postcode lottery in healthcare.
which is basically how where you live can actually influence your access to medical treatments.
Yeah, that one really blew my mind when I first read about it.
It's pretty shocking.
But first, let's clear the air, literally, and talk about pollution.
Sounds good to me.
Now, the sources mainly focus on air and noise pollution in the UK.
Right. Big issues here.
One of the BBC articles talks about how traffic fumes, car exhaust and all that, can make respiratory illnesses way worse.
Things like asthma and bronchitis.
Yeah, I mean, we've all had those days where the air just feels thick,
Mm-hmm.
but I never really thought about the long-term effects.
It's easy to overlook, but those fumes contain lead, and studies have actually linked that to some pretty serious developmental issues in children.
Hold on. So just being exposed to car exhaust can affect a child's development?
It can impact things like attention span and learning abilities. It's a prime example of how pollution can quietly shape a person's life path.
Wow, that's pretty scary. And this stuff is everywhere, especially in cities.
It is, and it raises a lot of questions about environmental justice.
Mm.
Who is most exposed to these pollutants, and what can be done to protect those vulnerable communities?
That's a really good point. It's like the pollution itself isn't the only problem. It's the fact that it often hits certain communities harder than others.
Exactly. And this brings us back to that social impact we talked about earlier. Imagine living in an area with high levels of air pollution. It could make it harder to exercise, play outside, you name it.
Yeah, or even just get a good night's sleep. I hadn't even thought about that.
Right. So pollution isn't just making you sick, it's actually limiting your ability to live a full life.
Especially if you're a kid who just wants to run around and be carefree.
Exactly. And this ties directly into the concepts of health inequalities that you guys are learning about in Miss Hart's class.
Okay, this is actually making a lot more sense now. It's not just pollution versus no pollution. It's about understanding how these environmental factors create different levels of risk for different people.
Precisely. And that complexity is something we're going to see throughout this entire deep dive.
Okay, well, on that note, I think we need to give noise pollution a bit more attention, and we kind of glossed over that earlier.
Yeah, for sure.
The sources mention it, but I don't really get how noise can be a pollutant in the same way as, say, car exhaust.
You're right to call that out. It's not something we see or smell in the same way, but it can be just as harmful. Constant exposure to loud noise, especially in urban environments or certain workplaces, can have a huge impact on both physical and mental health.
Okay, so give me an example. What kind of impact are we talking about here?
Well, think about sleep again. If you live near a busy road or a construction site, that constant noise can disrupt your sleep patterns, leaving you feeling tired and sluggish.
Right.
Over time, this can affect your concentration, your mood, even your physical coordination. It's like a slow burn that just wears you down.
So it's not just about being annoyed by the noise. It's actually messing with your body's ability to rest and recover.
Exactly.
I never thought of it that way.
And this is where the social aspect comes in again. Imagine trying to study for those big exams with jackhammers going off outside.
Oh, yeah.
Or having to constantly tell your neighbors to turn down their music. It can lead to stress, conflict, even social isolation.
And that's not even considering people who work in loud environments.
Like construction workers?
Factory workers,
They
musicians?
must be dealing with some serious noise pollution every day.
You're telling me.
And that actually leads perfectly into our next topic, occupational hazards.
It's funny, right? We always think about the obvious dangers, like, oh, you're a construction worker, you might fall off something.
Right.
Or, if you work in a lab, you might be exposed to dangerous chemicals.
Makes sense.
But noise as a hazard, we don't often think about that one.
I guess you're right. It's not as visually dramatic, like seeing someone actually fall from a scaffold or something.
Yeah, exactly. But the long-term effects of noise, they can be just as bad.
Oh, for sure. And the sources highlight so many other occupational hazards, too. Stuff that's not even a physical injury.
Like, have you ever heard of repetitive strain injury?
Yeah, I think so. Isn't that from, like, using a computer all day?
Yeah, exactly. Or think about things like verbal abuse.
Mm.
People who work in some customer service roles.
Oh, right. So we're thinking about hazard way more broadly here. Definitely. It's not just about immediate danger.
It's like the slow and steady impact on your body and mind, the wear and tear.
Exactly. And the effects of these hazards can go way beyond the workplace.
Oh, total.
Like, imagine having chronic back pain from lifting heavy things at work,
Oh,
or, being emotionally exhausted because you deal with verbal abuse all the time.
that'd be awful.
It can really affect your personal life, your relationships, your hobbies, everything, really.
So it's this like ripple effect, right?
Yeah.
What starts as a workplace problem ends up affecting everything.
Yeah, exactly. Your physical health, your mental well-being, even your social life, it's all connected.
And we need to be aware of that.
We do.
Yeah.
And it's important to remember these hazards can be present in any job.
Oh, you mean it's not just like construction or something?
No, not at all. Even jobs that seem pretty safe on the surface can have hidden dangers.
Oh, okay.
Like, remember we were talking about part-time jobs?
Yeah.
Even something like working in a cafe. You could get repetitive strain injury from, I don't know, making coffee all day.
Makes sense.
Or you could be dealing with really demanding customers, and that can be super stressful.
True.
It's all about being informed,
Yeah.
Making conscious choices about your work environment.
I'll definitely keep that in mind when I'm looking for a summer job.
Good thinking.
Hmm.
And this brings us to another factor that can have a big impact on your health and well-being.
Okay.
Geographical location.
Right. The postcode lottery.
Exactly.
This one really got to me. It seems so unfair that where you live could determine the kind of care you receive.
Yeah.
The sources, especially those reports from the Belfast Telegraph and the Mirror, they paint a pretty bleak picture.
Yeah, they do. They focus specifically on the inequalities in access to urgent cancer referrals.
And it's in Northern Ireland, right?
Right.
It's crazy to think that people are facing longer waiting times and stuff just
Yeah.
because of where they live.
It's true. And it's not just waiting times. It's also limited service availability and even restricted access to certain drugs.
Like your health is partly determined by your postcode.
In a way, yeah, it's a complex issue. And, the sources really just scratch the surface.
Right.
But it highlights a crucial point. Access to quality healthcare is not equal for everyone in the UK.
That's a big problem.
It is. And it has serious consequences for people's well-being,
Yeah.
physically and mentally.
Yeah, I can imagine.
Imagine living in a rural area with limited access to specialists.
Right.
Or having to travel miles just for basic medical appointments. It can delay diagnoses, make existing conditions worse, and create a ton of stress and anxiety.
It's like adding another layer of difficulty when you're already dealing with health issues.
Exactly. And it's not just physical health either.
Oh, right. The sources talked about the social impact of geographical location, too.
Exactly. And it's not as simple as saying rural is bad and urban is good.
Or the other way around.
Right.
Yeah.
It's way more nuanced than that.
Well, yeah.
Like, isolation and loneliness can be a problem in remote areas.
Especially for, like, elderly people, right?
Yeah. Or people with limited mobility. But then some urban areas have issues with crime, overcrowding, or a lack of green spaces.
Yeah.
And that can really impact mental well-being and quality of life.
So it's this mix of things, right?
Yeah.
Creating health inequalities based on location.
Yeah. It's not just healthcare, it's the social environment too, the opportunities or barriers that exist in different places.
Okay, I see. So we've covered pollution, occupational hazards, and the postcode lottery in healthcare.
We have.
It's been a lot. Kind of heavy stuff, to be honest. Is there anything in these sources that's a bit more positive?
That's a great question, and it's something the sources do touch on. Let's go back to geographical location for a second. So we were talking about how your location can actually be good for you in some ways.
Right, not all bad news.
Not at all. The sources point out that living in a well-connected area, one with good public transport, can make it easier to access healthcare.
Oh, that makes sense. If it's easy to get to appointments, you're more likely to actually go.
Exactly. Get those regular checkups, screenings, and early treatment if you need it. It can make a huge difference.
Catch those problems early on, right?
Exactly. And good air quality. Some rural areas or even cities with good environmental policies, they might have cleaner air.
And that's good for everyone, especially people with breathing problems.
It is. So it's like a win-win, right? Easier access to doctors and cleaner air to breathe.
I'm starting to think about where I want to live a little differently now.
And then there's the social side of things too. Living in a close-knit community, a village or a friendly neighborhood, it can really give you that sense of belonging.
Support too, right?
Yeah, exactly. And that feeling of community, it can really help with stress and loneliness.
It's like having people you can count on.
Exactly. And don't forget about things like community facilities.
Oh, right, like those day centers for older adults or those youth clubs.
Yeah, stuff like that. Having access to those kinds of resources can make a big difference in terms of, social interaction, staying active and engaged.
So it's not all doom and gloom.
Not at all.
It's good to remember that there are some good things about the environment that can really help us out.
Absolutely. It's all about being aware
Yeah.
and making choices that create a good life.
A healthy and happy life, right?
Exactly. It's about being proactive and remembering that we have some control over our environment, even if it doesn't always feel like it.
Wow, this has been really eye-opening. Pollution, occupational hazards, the postcode lottery.
We covered a lot.
We did. And for everyone listening in Miss Hart's class, remember, this is all stuff that'll be on your exams.
It is. Use this deep dive to help you understand those key concepts and really nail those questions.
Think about how it applies to your own life too, right?
Yeah, for sure. Think about the environment where you live and how it might be impacting your health. Maybe there are some things you can change to make it even better.
Good point. And on that note, we always like to leave you with something to think about. So imagine you could design the perfect environment.
Ooh, that's a good one.
What would it look like? What steps could you take to make your own little corner of the world a bit healthier and happier?
That's a great question to keep in mind as you keep learning.
Until next time.
Stay curious, everyone.